It's lovely to be here among all of you. And what is something which I wanted to talk about is being positive. What is positive about this red flag which you are seeing here? Red thing means, for me, it means blood. For me, it means a warning. For me, it says something to stop. And it also says something about the danger. So let me hit you with some hard-hitting facts about the retrovirus. Since the start, way back in 1981, when we first diagnosed something called AIDS, acquired immune deficiency syndrome, and in 83, we came to know it is the HIV virus which has caused this. A lot has gone into this last 35, 36 years. That is, in this epidemic, we had 70 million of the people getting affected by it, 35 million died. And 36.5 million are now living with this particular disease. It says about 0.8% of the adult population, that is a productive age group between the 15 to 49 years, are the people who are suffering as of today with this particular disease. And if you take geographic variations, sub-Saharan Africa accounts for 70% of this disease. This is 1 in 25 adults. So where are we standing? We'll come to it later. The most important point of this, significant point, is the mortality. When we talk about any disease, everything a patient wants to know is, am I going to live? What is going to happen? What is the death rate? Am I going to be cured? The thing about the mortality is the death from the AIDS-related and HIV is 3%, which is quite high. In the last 2015, we had 1.1 million people dying with this disease. And as a prevention protocol, there was a study in 2014 where 129 countries, which are the low-income and middle-income countries, have reported that they have tested, using the testing facilities and the counseling, of about more than 150 million cases. What does this show us? That we have come a long way. From the time of denial, that no, we don't have HIV in India or we don't have anything in any country, to the acceptance that there is this disease, and we are going to be tested for it. I think this has been the first positive report which we got, that people coming forward and consenting to give the rest and wanting to know about this. And where are we in India? What does this red flag tells us in India? The incidence is 0.26%, which is the national adult HIV prevalence, compared to 0.8%. So should we be glad about it? Yes. But where do we stand in Andhra Pradesh and Telangana? We want to go global. So we are 0.66%, something we are not proud of. Undivided Telangana and Andhra also were leading in the number of cases which we had. And then, but one thing we have to understand is this is a tremendous decline in the percentage from the time of 2001 to 2015, where we were 0.38%, the peak, coming down to 0.626 right now, men being 0.3 and women being 0.22. People living with HIV today in 2015 is 21.17. And can you guess the highest contribution to this? The undivided Andhra and Telangana accounts for 3.95 lakhs. Of this, children account for 6.5% and women account for 40.5%. So new HIV infections in India in the last year, that is 2015, is 86,000, coming down from 2.15 lakhs in 2001. That's a huge decline. That is 66% decline in the new incidences compared to the worldwide decline of only 35%. So we are achieving somewhere. Of this, what is important is 12% are the children. So living with AIDS is 6.5%, whereas the new cases are about 12% of children. Can anyone correlate with this ad campaign which is there? It is the Puliraja campaign which made a lot of difference. This is a change in campaign which government of Andhra Pradesh and Telangana, and actually that time it was an undivided Andhra Pradesh and the Tamil Nadu, in association with PSI, that is Population Services International, came up with this campaign called Be Faithful campaign, which said about awareness and telling them monogamy is the best. And if at all you're thinking about an extramarital affair, think of condoms. And telling that you are the sole donor of this infection to your family unit. This made a huge difference because government has taken forward from this, started the centers, started counseling, doing the testing, and started free retroviral therapy, treatment medicines being given from 2004. So what is the effect? In the effect, we always talk about the new cases and the death incidences. These are the two parameters on which we say did the effect come back with this campaign or not. So the death rates from the HIV/AIDS have come down to 54% in India, which is good because worldwide it has come down to only 41%. And in Andhra Pradesh and Telangana, the death rates have come down to 60 to 70%. So that is the effect of a good campaign which comes out along with the continuation in the form of medication which was free. So India could reach the MDG, that is 6th Millennium Development Goal, of stopping an epidemic and reverting back. This is a huge positive thing which has happened because of this. We could get down the incidence by 66% and deaths by about 54%. Let me take you with my tryst with this disease. Why is it that I got interested into this thing? As a PG, in 94, when we are young, enthusiastic, we want to do everything under the sun, and we think we are immune and we can save everybody in the world. A lady comes after 2 days after delivery with us, in a very bad shape, with pus all over the abdomen, and we were like, what to do? We didn't even think of anything. Everybody, all the PGs, doctors lunging on her, taking out the pus from the abdomen, putting IV lines and everything. We could not save her. In 2 hours, the lady dies. And then the report comes, the patient is retropositive. Now, the reality strikes us. Now, we have not worn any gloves. We were not using universal precautions. Now, what is the incidence? The theory hits us. It is 0.5%. Are we in it? So then we start understanding ourselves, waiting, taking Zerovidin for a month, which is terrible, and then waiting for all of us turning out negative. That's when the reality that anybody can get this disease has hit us. Then, as we came out of the 97, 98 times, we had a doctor, gynecologist, counseling a patient for the routine investigation to get a test done for a hysterectomy. Patient was very offended. The consent was very, very important. The patient says, if I'm getting HIV, you are operating on me. Please do your HIV test. The doctor gets the test, the patient gets the test, the doctor is positive. She just put down the paper there. She climbed up the building and jumped, and she died. It happened in 97. These are something which are realistic facts of a caregiver in this thing. Then, when I started my practice in 2003, 2004, in the part of a protocol of investigation, I got a HIV test positive for a lady. So naturally, we would not tell the patient first, call the husband, and we tried counseling the husband regarding that. Then the husband tells, yes, I know, I'm taking treatment, I'm positive. I'm like, why didn't you tell your wife? She will not accept, the family will not accept. Please don't tell that I am positive and she is positive. Please operate on her. And this is the mindset because of the rejection fear which she had. Then comes the next time, as the way goes on, 2008, 2009, when we had a patient coming to us with recurrent vaginal infections, and as a protocol, both doctors, we do the test, and the test comes positive for the wife, husband is negative, but the complete change in scenario, the bond, the way the family took care, because she had an accident for which she received some blood transfusions, and the way they were looking at how to avoid the infection, about the quality of life, how to go about from there. Now, the present day, I have quite a few patients who know they're positive, they're taking care of it, they want to have a child, now they know that they can have a child, they have a right to have a child, and they can avoid the baby from getting any infection. So this is where we have seen in the last 2 decades of my practice, what I see is the bond is stronger now, both between the patient and the doctor, doctors' confidence taking up cases like this and the hospitals taking up cases like this, between the family unit and the society at large. But let me show the other side of the coin. We always have 2 sides of the coin, always. So about the children, yes, we are telling 6.5% are living in this world, in India right now with the HIV. And the new cases, 12% are having. Where are we lacking? People are coming forward, want to have child. Yes, that's a right. Means where is it that when we know 100% we can avoid the children from having it, where are we lacking? Are we pushing them into this disease and making their life in the future very difficult? What is their fault? Did they ask for it? What do they need extra? They don't need anything extra. They just need, apart from the regular retroviral treatment, tender, loving care, and the support system, preventing them from having any disease. And if a disease comes, they want the treatment, proper treatment. But nutrition supplement is the most important thing. This is where the Desired Society, which is an NGO, which has been established in 2005, have started, has multiple branches. The first branch started in Hyderabad, and this is what we look at in the health and the well-being. In toto, they look at the health, they look at the medication necessary, nutritional supplements, education, integration into the schools, and also making them realize that this is the disease, the reality of the disease which they are going to face, and dealing with their depressions and seeing that they are emotionally and economically sustainable in the future what they do. Now, as a part of our this thing in the Desire Society, what we have seen in the last decade is that this huge positive response from the school, from initial resistance in the private schools for these kids. Now, presently we have 75 kids in the Desire Society, 50 of them going into the private schools and 25 going to government. But there is a lot of geographic differences. In Mumbai, in Vizag and Bangalore, no private schools have agreed. But in Gurgaon, 100% it is the private schools who are open for this. And this is our Desire Society kids, which was our Diwali with them last year. And this is another orphanage where we take care of all the vaccinations for them. And this is the family of Desire with 75 HIV positive, retropositive children living with HIV, the whole doctors unit, helpers, and all of us. And in 2013, we started this NGO called Pratyusha Support. Because it's only 3 of us, we are not looking at foundation. We are just help and support the other foundations which work with a lot of manpower, where we look at the preventive and awareness aspects of the many aspect of the health of the children and the women. And we came up with a commercial proposal to the hospitals. We tie up with some hospitals where 1/3 of the bill is paid by the patient, 1/3 by the hospital, and 1/3 is taken care by us. So I would like to walk the journey of my life in this little talk which we are going to have. We are 4 of us, but always coming from a family of orthodox belief that girls means they have to study only medicine or teacher. That's it. Nothing else is not for the girls. And fighting with the boys for every time that why should boys have all fun? Always they can play after 5 o'clock, but we are supposed to reach a thing. But having a killer's instinct, doing everything, trying to get the first in class, reaching everything, and want to be the class leader. And imagine, I was a sports captain too. And then, one thing I never fought with my father was that wanting to be a medical doctor, because I always wanted to be a doctor right from the 4th class. So one thing I never fought, but I think everything under the sun I fought with him for everything. But the major hurdle came to us when I just finished my 2nd year MBBS, and then we lost our father. So we didn't have, we did go through our own financial this thing, because we had my dreams to follow, and we were very clear, the whole family, the whole students, all of us being studying very young. And we wanted to pursue our dreams without any stopping us from anything. No earning member, but we were very, very clear what we wanted to do. And like I said, I was very clear. I wanted to be a surgeon. And now that is a major thing again. People in India somehow think lady surgeons are not good enough. So lady surgeons would not have patients. So only it has to be the male surgeons for them to operate on them. So then we thought, okay, let me be a surgeon who can have lots of patients to operate rather than sitting there with good expertise and not doing anything. That's when I went into gynecology, where there's a huge scope for the women and the same surgeries being done. Then when I was doing my 3 years of MD, we could see that lot of things which could be avoided, going into minimally invasive surgery to make life comfortable for them. And coming up with newer technologies was the need of the day. And so it is the technique which has to be improvised, technology, and the training and the team effort which is important. That is where we are. We could achieve many of the things. And my dream and passion is to teach these new techniques which took us a long time to next generation, which has been doing. Again, like I said, every coin has 2 sides. So let me show you the other side, which very few people in my life, except for my family and very close friends, know. Got married in 92. Everything was fine. Till 93 is the first time the health hit me hard. I was in and out of ICUs, admitted first time with the heart failure, with lots of medical issues, being resuscitated, lucky to have a doctor in the family who resuscitates me first before even taking to a ICU, and then getting frustrated, not knowing the reasons, and going through things, having twist of abortions and mid-trimester deaths, and then finally a pregnancy where they want me terminated, but I was very persistent that I would like to have the pregnancy. And this was 2 days before the cesarean, and nobody could even say that I'm full-term pregnancy in that. And imagine after that, this is the way I used to live. I lost 15 kgs actually. So it is like going in and out has taught me that I need to fix myself, and I am born to fix others too. So this has given me the other facet of it, that's saying to me, I was talking to myself, why me is not a question I need to ask. I was very lucky to be having some surgical hands, which very few people can boast of, and a memory which very few people can boast of. So why should I ask a question, why me? So I need to fix, and this is something which has taught me a patient's perspective of how a life where I'm a patient and waiting for a doctor, I would feel when the doctor takes delay and takes long time to even just make a diagnosis of my situation. So I thought that made a better person out of me. But health also made me go in search of the questions. So in 2005, I went to Mayo to evaluate myself, to know about the disease and how to take care of it as my multiple organs start failing, and which decade I need to be taking care of, in what organ I need to see. Being on, off steroids and lot of multiple medication, which I mean just to make me run. When people tell me Melodon, I get very irritated. It's one life, short life, why should I stop? This is something I keep asking myself. But that place, when 2 months when I stayed there, helped me in doing my other observership, helped me to understand the time when internet was not there, the technology which has to be got here, and also made me understand what is waiting for me back in India, my family, my friends, and the patients who were in need of me. So this trip has really made me understand that we are much better off in many ways. Did I balance my family? I think yes. Because when my daughter reached her first class, I stopped my evening practice. And I could do what all I could do, but the art of parallel thinking is something which made my work efficiency much better, and art of disassociation is something did not allow me to associate two different fields where both are stressful naturally for women, but still trying to balance it. This is where we reached last year, where we, through a minimally invasive surgery, we could take out 84 fibroids from a single small incision for a woman who wanted to have a child. People were like, remove the uterus, but it's a patient's right to have a child. I think we should give them options. That is the first thing we should be looking at. And the proud moment was for my achievements or for other things in the field of medicine when I could receive this award from the President of India. So finally, friends, do you think, can we as a society be positive? Thank you.